happy today to be joined by Dr. Sanjeev Sriram, also known as Dr. America, to talk about some of the health issues that are plaguing our country, in particular, some health disparities between different communities, different ethnic communities in this country. So Thank you so much for joining me.
Oh, thank you.
Can you tell us a little bit about who you are and why you go as Dr. America?
Yeah. So I'm a pediatrician in Southeast DC, and Dr. America kind of came up as an activist persona because when I would go out to rallies and protests, and I would wear the white coat over just like my regular work clothes, I got the feeling that people felt kind of intimidated, like, oh, I don't know if I can really approach this guy, like, let me have like everything put together first. And I'm a very casual person, and so I thought, you know what, let's just like cut all of that and let's at the same time appropriate, or reappropriate some symbology here. And I just threw on, I'm a comic book nerd, and I thought, I'm going to be Dr. America. And I just, threw on this shirt and put the white coat on top. And at WEAC Radio, I used to host a podcast called Dr. America. And so when I'm doing that work as a health justice correspondent, it was nice to kind of have something that was different and eye-catching, yet approachable.
Okay, so that's perfect because, one, the kind of hesitance that some people have talking to their doctors about their issues. Am I accurate in saying that's part of what's going on with this these health disparities? That there's not an appropriate amount of communication or bias or something that's going on between patients and their doctors?
Oh, absolutely. I did my training in LA, and now I work in Southeast DC. So my patient populations and the communities that I've cared for have always been either Latinx or African American. And so every time I step into clinic, I'm like, my challenge has always been to bridge all of these gaps across gender, culture, language, socioeconomics, and I'm extremely cognizant of that whenever it comes to our communication and wanting to build rapport. And I always look at earning my patient's trust as an active process that has to happen at every single encounter, and that I don't just take trust for granted once I've earned it, that I realize I need to maintain it. And with that, I think that I've been able to overcome a lot of these differences, and patients have been more willing to open up to me. But I think that is kind of the responsibility of somebody who has been put through the education and training, is to create those spaces where people can open up to, people who don't necessarily share their background. And before you know it, you've got teenage girls telling you their things about their periods that they wouldn't even tell like their big sisters. And it's a lot of responsibility to hold on to and to guide that person through their fears and their worries. But I think but it's not impossible. I mean, right. I think that it just takes, some breaths and some humility to do the work right.
So for people who might not be aware, what is going on? Can you give us a little bit of background with particularly what's going on with the disparities with respect to maternal mortality rates and infant death rates?
Yeah, so what we have going on across the board nationally is that you have moms who are black moms who are twice as likely to die as white moms during or after childbirth. And then for their infants, black infants have a mortality rate that's 3 times higher than white infants. And I want to emphasize that that's a national average, because when you go into city by city, state by state, you start to find that those numbers can be a whole lot worse. And a few years ago, I remember a public health expert, guiding us through the numbers here in DC. And she was saying that, when she had been to sub-Saharan Africa, that the numbers were comparable to what we were seeing in Southeast DC. And yet just across a river in a small town like DC, you've got some of the highest rates of maternal success. And so how is it that you have failure and success so close together and separated only by a river? And I see that happen all the time with almost any condition you can think of.
So how is that? What is going on? What are some of the factors that create that disparity?
So to me, structural racism is the number one, right? Like, that's our oldest culprit. It's the most ingrained culprit. We have a healthcare system that fundamentally does not want or look forward to everybody being healthy and thriving. We have a healthcare system that is fundamentally built upon who is deserving and who is undeserving. And race has a huge amount to do with that because of the way that undeserving and deserving plays into racial hierarchies, even outside of healthcare. And so all of those hierarchical systems that are built upon race end up having an impact on health just because of the way that now that we're learning more about toxic stress, the way that things happen along the epigenetic line, people are born vulnerable. And then, vulnerable people struggled through their life, not even knowing that they were put in this position for no fault of their own. And these vulnerabilities become part of almost like family heirlooms that are passed down the line and either get exacerbated or every now and then maybe a little bit better.
Yeah.
But it's still like not necessarily wiped out at the root.
So I want to pause because you said epigenetics, and I know we're getting a little bit in the weeds here.
Yeah.
But what's funny is I was actually explaining epigenetics to my boyfriend the other night.
Yeah.
Because I think it's fascinating. I was a history of science major, and in school, right, we grow up and we learn, okay, Darwinian evolution works a certain way. Your genes don't really change. Like, it's natural selection over time.
Yeah.
There was this guy named Linnaeus, and he thought that like genes changed, and that's why you have a different kind of,
right.
You change in your life, and then you pass that on, and that was supposed to be hogwash. Now we're learning that what happens to you during your life can actually have an effect on your offspring.
And especially during childhood, because everything is so plastic and so vulnerable at that time. So when you look at this country's history, we've been terrible to children of color since the very beginning. I know that, this is not to, disrespect anything happening at the border, but we've been separating children from their parents since the country's foundation.
Right.
It's a huge part of who this country has been. And that trauma that starts at such a vulnerable young age, it is how the seeds of mistrust and stress and I think that the stress of who can I rely upon? Is anything going to be stable around me? And to live your entire childhood like that, we can only imagine what kind of adults we create at the end of all of that.
Right.
And the same thing is happening at the border, and the same thing happens even in mundane exercises where kids fall in and out of insurance, where their parents get, insured, uninsured. All of those, those might not be on the same level of stress as being separated from your family, but there's still most definitely some kind of an impact because your stability has been upended.
Right. So what it sounds like is there's this kind of complex and inextricable relationship between racism and some of the consequences of racism that are a jumble of race and economic factors, right? So in a racist society where it's more difficult to secure housing, or where there's an income gap that means that Black and brown people are disproportionately living in low-income housing. That means you have the stress of not having secure housing. That means pregnant mothers are enduring the stress of not knowing where they're going to live or where they're going to be able to give birth to their child. The stress of not having insurance, of not being able to get prenatal care, of not being able to get postnatal care because of a lack of insurance, of living in housing that might give them exposure to lead and other kinds of elements. So what do you say? How do we start to go about ameliorating all of that complex cluster of factors that is going into these disparities?
Well, I think that there's something about America that hates confronting its vulnerability and just owning that all of us are vulnerable. Whether by biology, history, finances, whatever, all of us have vulnerability of some kind or the other. And if you don't feel you have vulnerability yet, just give biology your time, its due course. And before you know it, you're going to be vulnerable in some kind of way. Yeah. And I think that instead what we do is we attach vulnerability to virtue. And that if you are vulnerable, then that clearly is a lack of virtue. And if you are invulnerable, that's because you were virtuous. And it's in fact, the truth of it is that a lot of the things that we consider virtuous behaviors are things that happen in safe, stable environments. It's easy to do delayed gratification and study for an exam and not go hang out with your friends when you kind of feel like, oh, but if I do this now, it's going to pay off.
Yeah,
like,
or the financial advice that says, well, why aren't poor people saving?
Right,
Like,
right.
You don't have any money to put aside.
Yeah, I mean, and I see this even in healthcare where, I've got colleagues who criticize moms for having, like, their nails done and the hair done, and, their health is not doing all that great. And that criticism of, like, well, if she has the money to do all that for her hair and her nails, like, why doesn't she take better care of her health? And I have to always hit that pause button at work to say that, how good she feels after she gets that nails and hair done? That might be the only time she gets to feel good about herself for the next quarter.
Yeah.
And whereas, like, doing the work that it takes to be healthy, sure, there's a long-term payoff for that, but no time during the grind of being healthy do you get to ever look at yourself in the mirror or, like, just take a step back and feel, I feel good. Like, this is nice. In a very concrete, satisfying way that getting your hair and nails done kind of does it.
Yeah, I was literally just having this conversation with the woman who sits next to me at work whose nails look very nice. Where mine do not. But I want to talk about a particular issue, which is that one thing that's really interesting about this, the racial disparities in this area, is that it affects even higher income Black women, right? So some high profile cases happened in the last few years where Serena Williams had a very difficult pregnancy, and so did Beyonce Knowles. So, what's going on there? Is it that those kind of stressors are still, the race-related stressors are still affecting them? Why is it that even highly educated, affluent women are still affected?
Well, I think that's almost kind of like where you see racism do this turn of that, oh, well, we already know that Black people are invulnerable to pain. And if you're a wealthy Black person, then you must have, like, the double invulnerability of wealth and being Black. So what's your problem? Like, you should be doing great. And it's not recognizing that, no, pregnancy is a risky endeavor. There are tons of vulnerabilities that come up with going through a pregnancy just as a human. Or, regardless of, like, even before you get into, like, what are your financial resources like? What is your housing situation like? Your education like? Even before you get into all of that, just having a human body go through the process of making another human body is a stressful thing. And
I can imagine.
And I think that, what, at least for me, what I took away from Serena Williams and Beyonce's experiences were that, welcome to how, like, that human vulnerability does not care, how much money you made or what contracts you signed or how famous you are or how many followers you have. Like, biology, like, will get you one way or the other.
So, a fatalist might say, okay, Serena Williams and Beyonce, this can happen to them. Is this even an issue about, is there all the kind of, like, housing stress? If it's happening to wealthy women who don't have those concerns, should we even care about everything else? Like, how should we be focusing our efforts somewhere other than, providing insurance and all these other things, which are also predictors of high mortality rates?
I mean, I think that to me, like, I've heard that fatalist attitude too, and I've always felt that it's a bit of a cop-out. It's because I kind of feel that is never something that we would accept for our own families. Like, I mean, when my wife was pregnant, I mean, I got in touch with, like, how risky everything is and how powerless you can feel as a partner when you're at the hospital. And the only thing that you think that is going to help you out is knowing some of the jargon that you overhear. And even that, it's still, like, not enough power to to create outcomes. You're still kind of at, like, these places where biology is going to do what it's got to do.
And you feel that way even as a physician.
Even as a physician, you feel that way. And so when I look at the things in our world that we do have some kind of impact upon, I feel that you have a moral imperative to build upon those things. I mean, my brown butt is not here talking to you as a doctor because anybody played it safe, because anybody gave in to fatalism back in the day and felt that, well, those Brits had a really good empire and, hey, they're on every continent. All right, you win some, you lose some, and they won that. Nobody did that. Instead, it was people organized, people, fought for their freedom. And even in this country, to go from being a second-class citizen to being an equal one is still an incomplete process. There's still tons of work to be done. But if it wasn't for the risks that were taken and there was no predictable outcome for anything that happened so far in the civil rights movement, right? My being here was not guaranteed.
Right.
And so because people were willing to sacrifice who didn't even know me and didn't even know this life trajectory that I'm on, I feel compelled to pay that forward. I feel that, this is proof that effort does work. And even if that payoff is not something that you'd necessarily going to see with your own eyes in your own family line.
Well, what strikes me about the Serena Williams example is that the narrative, as she tells it, is that she felt like something was wrong. Mm-hmm. She raised her voice and she was ignored. And that's the piece where we, see some racial bias. There are studies that show, as you mentioned earlier, that doctors will perceive Black patients to be in less pain than white patients. I read that that's even at the root of why there's these disparities between where the opiate crisis has hit.
Right.
More opioids were just given to white patients, and has had this negative consequence that they are facing more of an addiction problem, although it's spreading more into the Black community as well. But there's another part of that story, which is that perhaps because she's empowered as Serena Williams, ultimately she keeps making noise.
Right.
And ultimately, she survived, where so many women didn't.
Yeah.
So when she's brought up as an example of why, kind of power and class is irrelevant, I would caution people to say, it is not a panacea.
Right.
Being wealthy certainly does not save you. Black women, even as, wealthy, educated Black women, have outsized, disproportional, the disparity exists absolutely. Right. And so without addressing racism, there is still an unconscionable gap, even among those who are very affluent. However, there are a set of factors that we can address without doing this, laudable but very difficult task of alleviating racism. Mm-hmm. And so I want to talk to you a little bit about what are some of the controllable, in terms of a policy, from a policy perspective, what can we do as administrations, as policymakers, as politicians, as advocates to shrink the gap? What tools are at our disposal?
So one of the first tools that I think of is Medicare for All, simply because it gets people through the door of clinic. And I mean, again, I don't believe Medicare for All is going to fix all of racism in medicine or anything like that. I know,
I don't think there are very many people who do.
I mean, and I think that, there will still be tons left to do in terms of racial justice, particularly in healthcare, even after the passage of Medicare for All. But as far as getting patients to the door, I believe that is a powerful tool that we have at our disposal, because when you look at the uninsured currently, 59% of America's uninsured are people of color. Now, we were told by all the demographic experts that America was not going to be a majority minority country until about 2040. And yet our uninsured population is already there.
Yeah.
And that's not an accident. That is a result of policy being, either used or unused or abused or attacked in ways that leave people, in certain specific people of color, to be very vulnerable to in the terms of their health, which should be a basic human right.
I mean, a lot of the states that rejected Medicaid expansion, for instance, under Obamacare, are these redder states, but that are also blacker states.
Right.
Disproportionately Black people are living in these southern states like Mississippi, South Carolina, et cetera, which have some of the worst health outcomes in the country. So can you help to unpack a little bit, what effect does not having insurance or being on Medicaid, which I've read is another predictor of having poor birth outcomes, what effect does that have? Why does that have an effect, rather, on maternal mortality rates?
Right. So when it comes to being uninsured or, being on Medicaid, but not having confidence that you're going to get to hold on to the coverage, because if you happen to do a little bit better at work and you start to, earn past the eligibility point, then you're going to lose your Medicaid. And for a lot of working class people, these are the realities that happen again and again, that you go in between these periods of being briefly uninsured, then covered by Medicaid, then, if I just stick at this job long enough, the benefits will kick in and I'll be covered again. Yeah. And that fluctuation of being uninsured, partially covered, hoping that coverage will kick in, it changes your decision making about going to the doctor. When if you rewind back to a woman's life trajectory and look at preconception, where before she even decides that she wants to have children, she should be getting an annual physical to learn more about her own health, stop problems before they become bigger problems, and to just get questions answered. Have some peace of mind about, well, this is the way that I've always had my cycle. Is that normal? And it's like, that's a great conversation to have with your doctor, and if necessary, to work it up.
Yeah.
But if you don't have, access to that, or if that starts to look more and more like a luxury or privilege, then you're going to postpone going to the doctor until you really need it, or until the system even says, oh, now you are worthy of coming to the doctor.
Right.
And I think that with Medicare for All, we have the opportunity to just start to unravel some of that culture of, are you worthy or unworthy of being at the doctor's office?
So there are these women who, even before they get pregnant, are going into the pregnancy potentially with a health situation that is not ideal to give birth. So I read, for instance, this statistic was crazy to me, that 20% of African Americans over the age of 20 have diabetes, either diagnosed or undiagnosed. And diabetes has an effect on pregnancy outcomes. And that there's myriad, illnesses, heart disease, hypertension, et cetera, that similarly have an effect on these pregnancy outcomes that people aren't getting treated for because they don't have health care, or because they have, here's another issue with the Medicaid issue. We met in Philadelphia where we were there to protest the closure of Hahnemann Hospital, which is a hospital that has existed for almost 200 years.
Something about that.
In Philadelphia, that serves disproportionately Black and brown people. I think 2/3 of the people who serve there, and also disproportionately serves people on Medicaid. And something that ends up happening, again, because of this bias, that's not just racial bias, there's some class bias, that patients who are on Medicaid will be attended to less sensitively, or less there's less investment on behalf of medical professionals. And so people are giving birth in hospital hallways, and there's incredible wait times and things like that, just because people are low income.
Right.
And so part of the lack of care, or the outcomes, again, are tied to these economic factors, which of course in a country that's pluralistic and has had racial hierarchies since its inception, are going to also be racialized. Right. Like the idea that we can extricate these things is kind of ridiculous. Right. Okay. So we have getting Medicare for All is something that we can do. You talked a little bit earlier about some of the stress related factors. So are there things that we can do? Like, for example, would a housing plan that takes that stress off the plate for...
when it comes to housing, the number of times that patients, a large part of my patients have to do when they come to clinic is update our front desk about their change of address. And they would have just moved a couple of blocks. And the fact, the family, in a strange way, they adapt. And I think that they do so in the sense of we need to get a roof over our head and get through this. But in those series of adaptations, I kind of wonder whether the whole system is never going to hit that pause button and say, hold up a second. Yeah. This is a mom with 3 kids. Should they be moving this often? What is making them move this often? Yeah. And to have stable housing is I think such a fundamental part of our human experience. It's where, almost everyone looks at their home at some point as some kind of haven, whether that be personal or with your family. But the idea that home is your safe place, that you know where it is, you can always come back to it, that you're going to be warm and fed. And that is not an easy assumption to make, especially for people of color in this country. Yeah. And those are the kinds of health outcomes that I can't write a prescription all the time for that. There's tons of advocacy that pediatricians do around housing. My colleagues are very involved with a lot of that. and we push for stronger housing programs all the time. But I think it's one of those issues that if we actually did it as a country, as opposed to just leaving it up to a few do-gooder regions here and there, I think that actually sends, again, a cultural message that all of us are worthy of a home.
Yeah. When you think about so much of in the popular imagination, our cultural imagination, we watch these movies like Father of the Bride. You know, when you have a baby, it's all about nesting and painting the room, and there are these montage scenes, and you do, you know, all these like gendered color explanations in the bedroom, and then the reality for probably a majority of Americans is not just not nesting with a full like $1,000 worth of Pottery Barn materials, but to literally not know where you're going to be living next month. It's an extraordinary thing to wrap your head around. And what I'm hearing from you is that, you know, there are people who have presented solutions to the maternal mortality rate that don't start with Medicare for all, which don't start with ensuring every American, right? Because we know, and again, in this country that has these racial hierarchies, if we have a healthcare system that doesn't guarantee insurance to all, we can all predict who disproportionately is not going to be insured, right? So there are these people who have presented solutions that don't include Medicare for all, which provide incentives which would punish hospitals like Hahnemann Hospital for having bad maternal outcomes, when really they have bad maternal outcomes because it's a hospital that's actually willing to see Medicaid patients, you know, lower income patients, right? So providing kind of a perverse incentive there. You know, it seems like it requires a systemic approach, a policy platform that says we're going to provide housing as a human right, we're going to provide healthcare as a human right, we're going to provide education and resources as a human right. Because just there's no one thing that you can point to. Oh, yeah. There's no magic bullets in any of this. I mean, the number of times that I've gone to the grocery store and I see a pregnant mom on her feet working at a job that I know that job does not have a predictable schedule. I know that her workload does not necessarily have any kind of predictability to it. The day that one nice manager is on vacation is going to be a really rough week for her. Yeah. And this is, and I'm not saying that pregnant women shouldn't work. It's that they should work with jobs that have dignity, that respect what the processes are, that they respect that, this person is going through a vulnerable period of their life. We as a workplace can adapt. Yeah. And and these are all of the little things. It's always, to me, it's all these little pushes and nudges that everybody contributes to that build our collective public health as a public good. Yeah. That becomes something that all of us are invested in and all of us actually benefit from. Yeah, and you raise an interesting point. You say, it's not that she shouldn't be able to work, but we are also a country that is well behind most of the industrialized world with respect to the leave time that women get either before or after their pregnancies. Yeah. So there are women who are not recovering, correct me if I'm wrong, they're not recovering from the trauma of childbirth and being forced right back into the job market, or not being able to rest the way they need to, or it's been indicated by their doctors they need to rest prior to giving birth in order to secure a healthy pregnancy. Yeah, and we know from science, from medical science, they've looked at medical leave and especially at maternity leave, and they feel that the minimum time that's good is 12 weeks. Yeah. And yet I feel like and I was expecting this, like when I was, talking to my employer, I thought, we follow science here, right? 12 weeks. And the message I got back from HR is that, but we're talking about your paternity leave. You get 2 weeks. And I was like, hold up. Like, you're telling me that my partner has this other person, and I'm a pretty involved dad, and I have to be back at this job. Yeah, bye, honey. You're split from tip to toe, but I'll see you in 8 hours. Yeah, she's not even fully recovered from the childbirth process yet. This is a newborn that we're talking about. Yeah. And yet we have, even in medical workplaces, we don't always adhere to the science that we know is right to keep people healthy. And so I think that there are, to me, I look at Medicare for All, I appreciate all the provisions that are there. I've gone through the policy, I'm really familiar with it, but I know that it is not this panacea that, we prescribe this and everything just radiates from there. It's like, no, this is the contribution that we make to this part of the system. Workplace justice is still a huge undertaking, and it has a lot to do with health. It's just that we don't necessarily always, as doctors,
what they think about these policies.
Yeah.
Or when we do, there's always somebody coming back saying that, yeah, the shareholders aren't going to like that, so we're not going to go with that policy.
I think this is a really important point, because there's this way in American politics that we are used to understanding, policies that are designed to address particular ills as, the Briahna Gray policy to fix poverty, the Briahna Gray policy to fix the maternal health gap,
Yeah.
The Briahna Gray policy to resolve housing. And the reality is that if you take an issue, we talk about intersectionality a lot, but there is this intersectionality with respect to how to design policy that we have to keep in mind too.
Right.
And so the idea that some people might put forward like a fix that's labeled so that it seems like we're going to throw this amount of money at this problem, what it really takes to create substantive equality is to say we have to have a rights-based, humanistic approach to resolving these harms. And that doesn't mean, by the way, that the goal of addressing racism comes off the table.
Right.
Part of the Medicare for All policy, a lot of people don't know, is that it creates an Office of Primary Health, which figures out how to increase access to care, and includes how to train the workforce to address these disparities. Something that Bernie Sanders talks a lot about is funding HBCUs, fully funding HBCUs, so that we have more Black doctors. Canceling student debt means that those Black doctors don't feel compelled to take the highest earning job that they can, and they can go and work in some of these communities that are being underserved and have worse health outcomes. Are there any other kinds of things that I might be missing that are a part of this agenda?
Yeah, and I think you're really nailing it, because when I look at even my own colleagues, right, and the choices that they've had to make for career and for family, and realizing that how much, even among physicians, people quietly sacrifice pieces of their health here and there. People quietly sacrifice a dream here or an ambition there, just because they've got student debt that they need to cover, because their housing is ridiculously expensive, because they want, to afford better childcare. And then you start to find out, well, let's go back to some of these pieces you put down. Let's talk for a second here. And it's oh, this is why you're burning out.
Yeah.
Because, you gave up on this thing that used to bring joy to your life, once a week, and you decided to put that aside.
Yeah.
Oh, you originally came from a rural area, and that was where you always envisioned yourself going back home to, but you can't, that's not a place where you feel you can afford to make a living and pay back your loans. You start to see that there are all these fragments that we all leave behind. And I think that in some ways a lot of the capitalist run amok looks at those sacrifices and says that, oh, well, that's responsible decision making. You can't have it all. And it's this isn't really so much about having it all as much as it is that, a lot of us, when we wrote our personal statements to get into medical school, none of us wrote that, oh, I want to be a corporate shill that fills out paperwork for Aetna and does it again, and then uses a fax machine because they say that they lost it and they can't do electronic copies. I want to be on the phone haggling with the pharmacy about last year's formulary versus this year's formulary, and I promise you, if you let me in, I'll be the best at all of it. And it's that nobody wrote that. Yeah. I didn't write that on. Nobody writes that on their med school application essay. But yet, this is kind of what the system forces you to become.
Yeah.
And I do envision that, with a lot of the policies that we've been talking about, that people might be able to get back in touch with what has been driving them all this time, and actually put that sweat and grind and hustle into something that is productive for themselves and for their communities.
That's a really important point, because there's been some pushback about the idea that Bernie Sanders is going to cancel all student debt, right, as opposed to capping it at a certain salary level, as other candidates have said. And some people have said that's smart, because why do we need people who are making over $150,000 a year to have their debt canceled? Well, that's what we're talking about in many instances, is a doctor who might have $300,000, even $400,000 worth of debt.
Right.
who might be earning over $150,000 a year, but is paying an astronomical amount in student loans every month,
Right.
who absolutely is not going to be able to go to a rural hospital, is not going to
Right.
be going to one of these community health centers that, again, Senator Sanders has paid so much attention to and found $12 billion worth
Right.
of funding for to support in these communities that are underserviced. Hospitals are not going to populate those areas.
Yeah, and honestly, I'm a pediatrician. I'm all for the expansion of primary care especially to places that need it. But the number of times that I've heard families say, tell me about their loved ones who live in a rural area that need surgeons, that need specialists, that need mental health, and it's really tough to get those specialties out there when they are burdened with this kind of debt. And I think that especially when it comes to student debt, what I feel is unique about that burden is that this was work that people took on, and it's not just healthcare, but it's that people took on this work because they wanted to be bigger than what they were when they started the process, and they envisioned something for themselves and their community, and no matter how big or small that was, but it was larger than themselves. It's not the same thing as forgiving a car loan or a home loan. Like, those are things that, yes, those are really strictly for your personal enjoyment and satisfaction. But education has, no matter what major you are, I know that a lot of people like, to talk about STEAM and STEM, but it's even for the people who are creative writing majors, they were really thinking about writing the next great novel that almost any of us would have loved to have picked up.
Or just getting a liberal arts education that doesn't put you in a place where, as someone who went to law school, I ended up sitting next to a lot of people who had no relationship to how the world works, no understanding of history, no understanding of kind of basic human impulses. And you get these people making decisions about our economy, our legal system, which says things like willingness to pay equals ability to pay. We should, I could go on for ages about all the dumb things that were said by these ostensibly brilliant people at the law school that I attended. But the reality is that understanding how humanity works, being in professional career environments with people of different class backgrounds, if the only way you can access someone of a different class background is by reading The Jungle, then your English class did something better for you than a lot of these other STEM classes. And so I completely, entirely agree. Before we wrap up, I just really want to be clear because there is this kind of either or dynamic that has emerged by some people discussing the issue, particularly of the Black maternal health disparity, that posits that because race and racism is such an essential component of this that exists even among the very privileged, that it is a misnomer to suggest that any of the other factors which predict bad maternal health outcomes are inadequate.
Yeah.
And would it be accurate to say these other factors that we can't control are insufficient but necessary?
Oh, absolutely. Absolutely. I mean, insufficient but necessary is kind of a large part of what almost all of us do in healthcare, right? I mean, that when I've got obese kids who come back and tell me at their weight check that I gave up chocolate milk, and then I'm kind of looking at the Doritos bag that they're eating solo, and it's okay, insufficient but necessary, all right, your teeth are going to probably appreciate you giving up all that sugary stuff. So let's chalk that up for a win, and now let's start talking about these Doritos. It's we have to be willing to look at all the different fragments that got us to where we are and to do all the different augmentations that we can, never knowing really actually which augmentation is going to have bigger ripple effects than we could have anticipated.
Yeah.
And that's what I tell people about that when it comes to, yes, fight racism with all your heart. I mean, and prioritize
Absolutely.
it.
And to be clear, it is prioritized as part of
Right.
Medicare for All. There is this provision that says we have to have racial bias training
Right.
as a part of Medicare for All, and I think that gets lost in the story.
Yeah.
And unfortunately, and I really want to highlight that here.
Oh, absolutely. And I mean, I think that is also another part of even when it comes to the kinds of people that I want to see join healthcare from here on out, is that I don't really want the country club alumni kids to show up at med school because they were the ones who could, put down the tuition bills
Right.
for 4 years of undergrad and give up summers where they, chased whoever in some whatever part of the world or wherever,
Right.
instead of, going home and taking care of an elderly, loved one, or
Right.
or getting a job that is just kind of, retail or something. I mean, I want people who have lived life,
Yeah.
who know what it is to walk in those shoes, who know what it is to go to a pharmacy and open your pocketbook and realize I don't know if I can do groceries and the copays for these prescriptions. And people who have been through that that journey themselves are going to have a lot more to bring to the art and science of medicine than I think our current crop does even.
Well, I just really want to thank you so much for having this conversation with me. Your advice has been invaluable.
Oh, thank you. Thank you.
And I'm glad that there's a Dr. America out there on the streets.
Yeah, absolutely.
Is there anything, any way that people can contact you or find you, or that you want to tell people who are watching this video?
Sure. So on Facebook, it's facebook.com/Dr. America Show, all one word. And on Twitter, my handle is Dr. No dot and then my last name.
Perfect.
Yeah.
Thank you.
Thank you.